Good day. My name is Niek. I'm working with the OECD in Paris and a professor of social medicine at the University of Amsterdam, Amsterdam University Medical Center. First, apologies of not being able to have an in-person or real life interaction with you, because it's actually a pleasure to have the opportunity to address your meeting, which represents a group of Visegrad countries and Israel, and discussing the very important topic of health economics and the present situation. So what I will try to do in the next 15 minutes is give you some highlights of the thinking and the work that is going on at the Organization for Economic Cooperation and Development in Paris with respect to the present problems in healthcare. Next slide, please. I assume you are familiar with the OECD. All your countries presented today are members, but actually the OECD was set up in the aftermath of the Second World War and the Marshall Help to assist countries with producing expert knowledge, insights, and statistics that will help strengthening their economies. And that's still what we're doing today. Next slide, please. But of course, healthcare is an important part of that thinking about economic development and coordination. So a few words about the theory of health economics and its relation with health system performance. And of course, I'm telling you nothing new when I say that healthcare is a substantial part of the spending of national economies. Actually, that was the reason why in the late 70s of the previous century, the health division was set up within the OECD. And roughly, one can say that healthcare are considered as costs, which is the more classical way. Healthcare costs a lot of money, so we should try to contain it. But the more recent way of thinking about it, and it's also reflected in the work of the OECD, is to see spending on healthcare as an investment. Contributes to health of the population, and health of the population is one of the attributes of well-being that should be the ultimate outcome of economic development. So in that sense, the economists at the OECD look at it from both sides. And apart from looking at healthcare as costs and even more important as investments, they also try to assess the economic burden of disease. So next slide, please. This brings together different types of statistics and thinking that try to position the development of healthcare systems in the context of the overall economy. One, of course, very recent one is the changes in the spending on healthcare. And you're probably familiar with the system of health accounts, the international way, the OECD, but similar with Eurostat of the EU and the World Health Organization, compare spending in healthcare. This is a slide of the most recent data on healthcare spending, where in discussions, the OECD with the member states tries to get insight on what happened during the pandemic. And basically you see here that during the pandemic, there was an increase in the public spending of healthcare, up to 5% in most of the member states. We also noted that the private spending part decreased. And overall, you see a slight decrease when it comes from 22 to 21. The latest figures show a smaller percentage of the gross domestic product, but of course that is linked to the overall growth of the economies in the past years. But overall, we see drastic changes in the spending that are background information for thinking about performance of healthcare systems. Next slide, please. So there are various challenges that OECD countries, and including the Visegrad countries and Israel, are facing at present. First, you realize that healthcare spending is a substantial part of your national economies. And of course, you have to, in all countries, that means that you have to monitor the spending, but also are forced to start thinking about, is this spending a useful investment? That is related to a debate about creating value. That means that outcomes are not merely assessed in terms of life expectancy, but overall, there is a critical reflection of, do the investments in healthcare contribute to what is valued by citizens? So the whole concept of value-based healthcare that you might be familiar with via Michael Porter in Harvard thinking is also embedded in the thinking about the performance of healthcare systems. Another issue is the addressing of inequalities. Inequalities in access to healthcare, which is usually reflected through the financial barriers that exist, but also the actual use, who are using healthcare, and do we see inequalities in outcomes? Are people with higher socioeconomic status having better healthcare outcomes than people with a lower socioeconomic status? The COVID pandemic has had major impacts on the overall performance of our healthcare systems. And that's not just reflected in the excess mortality, the increased mortality we see. Basically, we see in the recent data from Eurostat that life expectancy in all European Union countries has diminished in 2020, and we see the same in the more recent statistic from 2021. But even more, there is an impact on the rest of the system. There have been waiting times, delays, postponement of screening programs, and a lot of the discussions now about how to deal with all these distortions in the healthcare system, but also seeing it as a challenge to transition the system. The word resilience is usually the label under which these discussions take place. We see systems having increased workforce shortages. They were already there, but they have been worsened since the pandemic. And the way how the labor market works in healthcare is therefore an important topic. In your region, especially the impact of the war in Ukraine is a point, the migrant streams and how to deal with that and providing healthcare services. And last, but surely not least, there are the environmental challenges of, for example, climate change. All this makes it very important to have good data information, but try to bring that all together in seeing how the health system as a whole is functioning. And this is exactly what is done with health system performance assessments. Next slide, please. So just some key economic concepts behind that. It means that you look at the system in terms of input, throughput, process, output, and outcome. You look at the different use of resources, and especially you look at the alternative inputs in the production process. How can I make that more efficient? How do I value different outcomes? How can I do a cost-benefit analysis that is broad enough to encompass all the societal effects? How do I operationalize the effectiveness of my system, the efficiency of my system, and the equity of my system? And in many cases, it means balancing the classical economic market thinking of supply and demand with the thinking from a public health perspective of demand and need. What is the demand of a citizen versus the need of the population as a whole based on the public health and medical knowledge that we have available. To show that this is not mere theory, but also practice, next sheet. OECD has already in 2005 developed an overall framework to assess the performance of systems. And actually this framework is filled with data on a regular basis to produce publications like Health at a Glance that give an overview. It encompasses of health, risk factors, the performance of the system in terms of quality, access, and costs, and two cross-cutting dimensions, efficiency and equity. Next one. And here you see the various structural statistical programs and data collection efforts by which OECD, often together with Eurostat and WHO, fills the various components of this framework. Next one. So, in essence, health system performance assessment is about health, but not just about death, but also about disability, disease, and increasingly about assessing the well-being of people. It's about system, but there's a distinction between the health system and the healthcare system. Healthcare being only one of the determinants of health, and health system including all the more contextual factors that help people to realize their potential health, and increasingly linking the classical healthcare activities with social care activities. With performance, it's linking the performance of the system as a whole, the individual services, and the cooperation between services. And the assessment has to do with the measurements, which I'm talking about today, but also how that is embedded in accountability mechanisms, improvement programs, and learning health systems, and the overall governance of the system. Next slide, please. This is only 15 minutes, so I will be brief, but here you see the key objectives that are can be recognized in health system performance assessment. And such a thing as health system performance assessment has been promoted by the World Health Organization now for 20 years, but in the past 8 years, more and more by the European Union as a way of helping healthcare systems to really identify priorities, inform decision-making, support coordination, measure and compare, promote transparency, and actually empower citizens to see what the results are of all these healthcare activities. Next slide. This is the framework that recently was developed in the process of 2 years with EU funding in Ireland. And it's a visualization, but it just shows you that in the middle, you end up with health status, but you need intelligence on cost, access, quality. You need the other constituting factors. And in the blue part, you see the data statistics on financing, workforce, and institutes. So I won't go in detail, but just to show you how countries try to visualize what they find important and try to combine statistics on these different phenomena. Next slide, please. Some highlight overview where the OECD tries to also give this information back to ministers, and this is very quick. But if you summarize health at a glance, and this is before the COVID pandemic, but we show in a snapshot the health status, and we see that basically life expectancy was increasing. As I said, over the past 2 years, that's not the case anymore, and there's a decrease. We saw an overall decrease in ischemic mortality and an increase of the dementia. Next slide, please. We have snapshot on risk factors, and roughly with smoking and alcohol consumption, it's slightly going better in most of the countries, but with obesity and air pollution, it's getting worse. Next slide, please. With healthcare resources, we saw that all countries were putting more resources in it, but overall there was an increase in doctors and nurses over a period of 10 years, and a reduction of the number of beds. That again is now really challenged because the workforce, the labor market availability for facilitating the increase with numbers of doctors and nurses is not really there in most of the member states. Next, please. Access. Those are the financing schemes with insurance, with population coverage, out-of-pocket spending, waiting times and differences over time. And the last one is a survey amongst the citizens. So how often people report that they skip a consultation because of the financial means. Next one. And this is a series of the quality and outcomes data that are collected and reflecting different things. I'll come back to this in a moment. Next one. Because the point I want to make is this, that if you want to anchor the spending in outcomes, it's important to realize that life expectancy, and death are no longer the main outcome parameter. They are complemented with information about diseases and disabilities, and increasingly information is collected on the actual well-being. Does healthcare contribute to health as experienced by citizens, becomes an important element in making the allocation decisions on where resources should be spent. Next one. So I promised you a little bit more on the quality indicators. There's a big debate on cancer. 5-year survival rates on most cancers increase over the past 10 years in countries, showing your cancer care is doing better. That is becoming more and more explicit now in work on the Beating Cancer Plan of the European Union, where the OECD is making country reports. Next one. Primary care is looked at. Here it's important to see whether, for example, diabetes patients are treated well in primary care and you prevent them going to the hospital, as is reflected in this slide. Next one. The use of medication is an issue, and especially in the antibiotic prescribing, a lot of modeling has been done for the G7 and the G20 on the long-term impact of not rationalizing your antibiotic prescribing. Next one. Mental health is a big problem, and here we see that especially in the past 2 years, the increase in mental health care problems in the general population as part of the pandemic needs rational addressing. Next one. And this are just a slide on the 30-day case fatality rate of acute myocardial infarction. So what are the chances that a person with stroke or myocardial infarction survives after being been to the hospital? You see differences between countries, but next slide. Also a lot of differences within countries. Next slide. Where these data show the distribution within countries of 30-day case fatality rate. This slide some years ago was a reason for the European Union to support Latvia in improving their cardiovascular pathways. Next slide shows the necessity of having information on the patient-reported experiences. So this can be done by survey. For example, I know that Hungary did 2 years ago an extensive PREM survey in its population. And next slide. A lot of work presently is done on patient-reported outcome measures, where the systematic measurement before and after a health intervention, as reported by patients themselves, is part of the intelligence used to assess the performance of the system. Next slide. All this can only be done when the country has a solid health data infrastructure that can feed all these performance indicators in the decision making. Next slide. That's why since 2010, the OECD has been working with member states on the governance of the data infrastructure. And this is one of the big policy debates presently taking place of how can you strengthen your data infrastructure, either by digitalization, better use of electronic health records, and also linking data. So next slide. A lot of reports and material is available on how countries can actually do this. So please, if this is part of your discussion, look at ways of strengthening the data infrastructure that can really inform the health system performance assessments for helping in the policy decisions. Next one. I'll come to a close. I know this is a lot of information in a short period of time, but the main message I want to bring across is that health economics thinking can really help in the periods that we're in now and the challenges that health systems are facing. But that means that please orient, if you haven't done that yourself, on materials that are available, statistics where your countries can look at its performance and the movements that the European Union tries to make by stimulating member states to help have a health system performance assessment framework can also help to make this assessment. Next one. That's what I wanted to share with you from a perspective of the Organization for Economic Cooperation and Development. I hope this gives input for your further discussions of how the present challenges can be met by a rational use of existing data, but also trying to look at the performance of the system as a whole instead of working solely on sub-optimization of small parts of it. Thank you very much, and I hope to have the opportunity to have a more interactive debate with you in the future. Thank you.